Welcome to Capitol Preview, a weekly bipartisan discussion with Iowa legislators about the key issues facing our state. Brought to you by Mediacom.
Welcome to another episode of Capitol Preview, a show that's brought to you by Mediacom and the Iowa Cable and Telecommunications Association to discuss with you the views of our representatives in both the Senate and the House. Our guest today is Representative Ann Meyer, representing District 9, which includes Fort Dodge, Badger, Vincent, and Clare, and Duncombe. Our guest today, like I said, is Ann Myers. We'll be talking to Ann here and discussing some of the things that Ann is up to at the Hill. So our first question today is, this is your first term. Ann, how are things going so far? And what's your initial impression of the Capitol?
Yep, this is my first term, just elected. Now we're in week 11, and it's crazy busy. It started out slow the first week when the governor gave State of the State and the Chief Justice, and that was a slow week, but since then it's been going nonstop. Lots of bills come across, really no bills that I've written. Mm-hmm. At this point I've been assigned to bills, so there's a lot of research, a lot of reading code, which is intensive reading.
Right.
But it's been great.
Is it a little different than you thought it was going to be when you ran? I mean, it
is a little different. Yeah. I will tell you, everyone, and what you don't see on TV, everyone works together. I think the news likes to put us at each other's throats, right. But everyone is there for the same outcome. We just probably have a little bit different way of getting there. Mm-hmm. Most of the legislation that we work on and pass through is bipartisan.
Yeah. I think we were talking a little bit about, before the show started, about how intense this process is and how difficult it is. I mean, you're reading a lot of these bills, interpreting them, right. Trying to figure out what purpose they play in your role. So yeah, that's
exactly. And in a lot of instances, I'm glad for our caucus staff that helps with that and helps with interpretations, and because my background is healthcare, it's not the law.
Yeah. Well, you got to. I agree. The support staff up there is phenomenal. So, you're Vice President of Human Resource Committee. You've had some experience in that area. Is that correct?
Yes. I'm a nurse, and this is my 32 years in nursing. I graduated back in '87, University of Detroit, Mercy. And I've been working bedside nursing in medical surgical units, in ICU. I've done home care. Right now I teach for Iowa Central Community College. I teach the clinical aspect of it at the bedside. So I really do have a lot of hands-on experience in the healthcare industry. My husband's a physician. I have that input as well. So I kind of know a lot about healthcare.
Yeah, you come to Human Resources Committee with a lot of experience.
Right.
Yeah. Human Resources Committee has a lot of big issues in it currently. What are some of the bills that you're looking at as a representative right now?
When I was knocking on doors during the campaign, I heard a lot of interest in mental health care. The state the legislature developed a framework for adult mental health care last session. This session we're working on a similar framework for children, so the children's mental health system. I'm very interested to make sure that goes nice and smooth, and we have adequate funding for that and the adult mental health services. Some other things we're working on in human resources, there's the governor's contraceptive bill. So what that does is it allows, there's a standing prescription for several different types of birth control, mm-hmm. and women will be able to come in, be screened by a pharmacist, receive education about the medication from a pharmacist, and we had some resistance to that bill, so I was in the subcommittee on that, and then before we brought the bill to committee, we did a lot of work on it. We addressed a lot of the concerns from the public in the lobby on that bill. So I think we brought a really good bill forth, and I hope we can continue to work on that. It's a great way to increase access to women.
I know that's one of the governor's projects, right?
Yes.
Is mental health for young adults. Right?
Yes, that was,
right.
She outlined that in the State of the State address.
Exactly.
That's correct.
Right. Can you tell me a little bit about the children's mental health bill? I mean, you kind of have touched on that a little bit, but is there anything else that you'd like to clarify or add to?
So it's just a way to get, and very basically, it's a way to get the services in the same place. So with the adult mental health framework, the state is divided into regions. We're going to follow the same region aspect and set the children's system up that way.
It seems to me that children's mental health is kind of lagging behind. It's not as advanced as the adult mental health care in our state. And why do you think that is?
I think one of the main reasons is lack of providers. We don't have a lot of provision. We don't have a lot of enough services available. So how are we addressing that? Well, in the another one of the governor's priorities is to bring psychiatric residencies, increase the amount of psychiatric medical residencies. So we want to increase providers. We want to increase nurse practitioners in the mental health area. Another thing we're doing in human resources, we just passed through, committee, and I do believe we passed through it on the floor last week, if I remember correctly. We want to give Iowa residents, people that are going into Iowa medical residencies, we want to give them priority to get into our residencies, because usually if you start out in Iowa, you do your medical residency here, you'll stay here. It's one way that we want to work to retain rural practitioners.
Oh, that's great. Yeah.
So we really need to attract practitioners to rural areas.
We'll switch a little bit to another topic that the governor also provides, making an access to birth control easier. You serve on the subcommittee of the birth control for that.
Yep.
Is that correct?
Yes, that's correct. So that.
Tell us a little bit about that. If you
So
would.
that's what I kind of talked about a little bit. Again, it's going to be birth control available behind the counter, not over the counter. We've addressed some of the concerns that people had when the bill initially came out. We think we've made a better bill, and so hopefully we'll get that onto the floor and pass through the House.
Just out of curiosity, Representative Meyer, what made you want to get into this? I mean, you've had a successful career in the medical health, and I just was curious of what made you want to come and serve in the House.
I think the main reason I got in was healthcare. We've had so many problems over the last 7-8 years in the healthcare system, and I feel like government has kind of had a little bit of a hand in that, and I'd like to give this perspective in the legislature, my background, to improve the systems that we have. That was the main impetus for me getting in.
Well, I applaud you for doing that, because a lot of people, they stay on the sidelines, and there's one sure way of making sure things happen, and that's getting involved in the game. So I appreciate you doing that. You managed a bill that addresses opioid abuse last week. What does that bill do?
I did manage that bill. That was my first bill to manage on the floor, so I was really excited about that. What that bill does is we talk about Medicaid. So if a person comes in with a substance abuse disorder to a clinic or a physician or emergency room and they want to be treated for that, we usually use medication to assist them. So it's called medication assisted therapy. This bill allows the patient to have access to that without a 72-hour waiting period. So if you went into the physician's office or a clinic and said, I want to get clean, they might tell you, well, we have to wait 72 hours until we see if Medicaid's going to cover your medication. This bill says that there are several medications that are available without a pre-authorization, because if someone wants to get clean, they want to get clean now. You give someone 72 hours, they might go right back to the street and start using again and possibly overdose. So this is just one way, a small way, but an important way to work on the opioid crisis in Iowa.
Very good. You also are on the Education Committee, and the House just passed an extension of SAVE.
Yes.
So can you tell us a little bit about that? Because that seems to be a topic that a lot of people are talking about right now.
And that was a topic with my school superintendent as well. Everyone's concerned about that. So what this is the SAVE penny. It's the 1 penny sales tax throughout the state, which provides for school infrastructure. Schools can bond against that. It's sunsetting in 2029. And so when we get closer to that, schools don't have access to as much bonding money because they know the funding's about to run out. So this gives them the security to be able to carry out infrastructure, making the schools safer, making them more conducive to learning. Also, it gives a little bit of property tax relief. And the bill that was passed on the House floor last week was extending the SAVE penny until 2051. So we're really hoping the Senate takes that up pretty soon and passes that through as well, so we can get that to the governor's desk.
Which brings us to we have a funnel system. We have a first funnel where bills make it, and then a second funnel. That's coming up pretty soon, right? The second funnel?
Second funnel, I think, is in 2 more weeks.
Yeah. So there are going to be a lot of scrambling to get some of these key legislation done before.
Absolutely.
Yeah.
Last week was our first week of debate on the floor, and it was pretty intense.
Yeah.
So I look forward to a few more weeks of that.
Exactly. Are you working on anything that affects locally your district? Any bills or?
Again, the SAVE bill I thought was very important. That went through my committee, and I was actually managing that bill in education, and then since it's a money bill, it went to Ways and Means, and then they manage that on the floor. So that's a big bill for my area. Also, when I was knocking on doors during the campaign, all I heard about was healthcare and mental health. So everything we're doing in human resources, I feel, really affects my district.
And what were their concerns? That they got timely treatment, or they had access to treatment?
Access to treatment. And even now, I had a long conversation about a week ago now with a woman who her granddaughter is involved in the system, and she gave me a list of different hoops that she's had to jump through and deficiencies in the system, and how her granddaughter, she's only 16 years old, and she's been in this process for 7 years, and it's really terribly affecting the family and the daughter. It doesn't feel like we've got a good system in place yet.
Yeah, I think there's a little bit of a lag, and we're kind of out of time here, but I think we're on a little bit of a lag of the issues that are put on our youth. We'll use them. I mean, the things that they have to deal with at their age. I have a couple 20-some-year-old kids too. And I just think that there's a lot of there's just a lot of challenge for them to live in this world. So yeah, I think we're kind of at a lag in figuring how big this problem is, and hopefully we can get some legislation to correct that. So
I would agree with that. I think things are a lot different for kids than they were when we were younger.
Exactly.
Yeah.
Well, that kind of wraps up our time for this morning. I want to thank Representative Ann Myers from Fort Dodge for coming in this morning and sharing with us some of the things that she's working on Iowans' behalf up at the legislature. So thank you very much.
Thank you so much.
For coming. Thank you for joining us here on Capitol Preview, and please stay tuned for another episode.